I think that would be is key. We really need and really be part of the people advocating for sugar to really be recognized as a major risk factor to NCDs.
I think also, I mean, when we talk about sugar, sometimes we might, you're right that, I mean, putting sugar under poor nutrition makes it, the intervention obscured and not really given, focus, or, I mean, that the intervention is not really focused in terms of how to deal with these things. So I think I would agree. I mean, I'm not going to say I'm a bit apprehensive. I don't know how this is going to play out, when this is going to be discussed.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases. And sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions Podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll!
Alright, thank you very much and welcome to another episode on the African NCD Youth Champions Podcast. Today we are going to talk about oral health and oral health as a non-communicable disease, and especially oral health in the contemporary terms as we see it developing and emerging into a global issue, and some of the interventions that are in the plan, in the pipeline, especially around oral health, and how to bring it to the front of, to bring it to the limelight in as far as conversations on non-communicable diseases are concerned. So without further ado, let's jump right into it. What is oral health and why should people be concerned about oral health?
Yeah, sure. I think there's a new area in the context of non-communicable diseases. And the definition of oral health, again, recognizing that, in simple terms, it just refers to as, healthcare around our teeth, things to do with our facial structure, things to do with the gums and all that. So it is health that is concerned with our teeth, that is to say, and the whole things to do with our face, that is just as I've mentioned. So that is really what oral health means, and what oral health means. And you asked the question around why should we be concerned. I think the reason why we should be concerned is because currently the WHO report indicate that there are around 3.5 billion people who are living with oral health diseases, and also oral health is not really covered as part of the mainstream universal health coverage. So we should be concerned about it, one, because of the amount of people who are living with this condition but is not really recognized, and sometimes it escapes the universal health coverage, is not part of it. So it's coming to the fore, being pushed by people who think now that now oral health should be part and parcel of non-communicable diseases and should be included in the 6x6 approach. And I'm looking forward to also hearing how this discussion will pan out in the upcoming 2025 UN high-level meeting on non-communicable diseases, where oral health is likely to be discussed broadly and also included in the among the 6 major risks. The major NCDs.
Yeah. So again, simply put, oral health is literally just the health and hygiene of everything to do with the mouth, and that includes the lips, the tongue, the gums, and the teeth themselves. So, and as you correctly said, oral health and now oral diseases, or to even be more specific, dental diseases, have been an issue for the longest time. They just haven't come to the to the limelight in as far as being given a lot more attention and priority is concerned. And the reason why we're even talking about it today is because it has risen to become a key topic of concern. Research puts it that 1 out of every 2 people in their lifetime, they'll experience an oral disease or develop an oral health complication or challenge. So that is why it is now becoming an increasingly vibrant topic that needs to really be talked about. And also, when we are looking now at the risk factor, that is with the biggest of them being sugar and its effect on teeth. We've seen a rise in sugar in processed foods, ultra processed foods, in drinks as well. And as the world is continuing to modernize, the sugar industry is also very strongly developing more and more products that affect individuals' health, not only after it has been consumed, but also in the process of being consumed. So as it gets to the mouth and it interacts with the teeth, individuals continue to develop oral health challenges. So I sort of want to move this conversation to talk about some of the examples that you know of oral diseases or dental diseases. I'll also come back to talk a little bit more on that, and then we will go ahead to see some of the risk factors, but also control measures. But before that, what are some of the exampple that you know of oral health challenges?
Really, oral health challenges. I mean, they're the things that we mostly, normally grapple with. But I would want to talk about oral cancer, which is one of those cancers that people experience with. Grapple with. There's oral, what we call the mouth cancer, which is part in one of the cancers that a lot of people are presenting with. But why are we forgetting things like tooth decay, which is just part of, oral health challenges that people grapple with, and how that is also connected, like tooth. I'm talking about tooth decay, but we can talk about even the cavities,
bleeding gums,
bleeding gums,
gingivitis.
There are things that we really know of, but I wanted to bring that oral cancer or the mouth cancer because it's. Sometimes we tend to miss this when we talk about oral health challenges, and that's why now proponents of oral health, those who want oral health to be included as one of the NCDs are really pushing for that to be included. So there are a lot of oral cancers, and I've just mentioned one, which is the mouth cancer, and a lot of others which do not really command, or their prevalence is very, very low, that sometimes people don't, they're among the rare diseases. Yeah, so you, I'll just throw it back to you because you've been in this field for a long time. Just to move the conversation from the types to ask you whether you think this idea of including oral health as part of NCDs, is it premature or is it something that you think will give oral health challenges a limelight?
Yeah, so yes, I've been working in the field of oral health for quite some time now, especially with C3 for Health in the UK, and also even actively with other industry players working to look at what are some of the emerging issues when it comes to oral health hygiene. Also because I have been affected with oral health diseases for the longest time due to my being born with childhood obesity, which as we said is both a disease and a risk factor to other diseases, including oral health challenges, as it would turn out in my case. So I think it's high time oral health comes to the limelight, and especially also be considered as part of the broader NCDs. Because even by definition itself, oral health is a non-communicable disease. You can't transfer it from one person to the other. The other thing is the amount of people it affects. 1 in every 2 people will have an oral health challenge or condition in their lifetime, and they'll have to grapple with it. And so that brings to the forefront of just how big of a situation this is, especially its impact on health, on wellness, but also on the global productivity. And that is why I think there has been a lot of push to also bring attention to oral health as part of the major non-communicable diseases. And what this hopefully will achieve for oral health as a key topic is to lead to the improvement or to lead to the inclusion of policies, regulations, and interventions to curb oral health now at a global scale, just as we've seen with the major non-communicable diseases. So I think that's why there's a lot of push locally and even globally for this to become a key area. And finally, in concluding, is that again, in looking at oral health and the management for oral health, just getting a tooth extraction is very expensive, but even moving further to get other corrective measures and interventions for oral health are not very cheap. So there needs to be this focus that can even lead to the incentivization and the reduction of access to services for oral health and oral health care. Yeah.
Okay. Again, maybe just a follow-up question, because right now we are pushing this 6. Having that oral health matched with sugars, but we also understand that there's also aspect of poor nutrition. Why do you think isolating sugars, and having it as a standalone risk factor is going to contribute towards addressing oral health challenges?
I think there needs to be more focus on sugars as a risk factor, and I think the food industry played their hand very well in hiding sugar as part of the poor diets. When you just say poor diets, there is a lot of things that are merged in there. But sugar really stands out as a key risk factor, not only for oral health, but also for diabetes as well. So I think and you see, once specific products have been put as core risk factors, then a lot of intervention is put to actually reduce or eliminate them. You can see that with the tobacco industry, where there's been numerous interventions to ensure that we are reducing and eliminating tobacco in the conversations. You can see that with alcohol. There's a lot of regulation, taxation, and advocacy to really reduce the consumption of alcohol and its production. And now, if the focus goes to sugar, that I think will be one groundbreaking intervention, in the sense that it really bring to the forefront the negative effects that ultra-processed sugars have on the human health, and not only for oral health. I think sugars will even present for diabetes. It will even present for cancers. It will even present for cardiovascular diseases. So it's going to be a big focus area, which might lead to a lot more radical shift in how sugar is consumed and the regulation around sugar, because sugar is hidden in a lot of foods that you wouldn't expect sugar to be in. So I think that would be is key. We really need really be part of the people advocating for sugar to really be recognized as a major risk factor to NCDs.
I think also, when we talk about sugar, sometimes we might you're right that putting sugar under poor nutrition makes it the intervention obscured and not really given focus, or the intervention is not really focused in terms of how to deal with these things. So I think I would agree. I'm not going to say I'm a bit apprehensive. I don't know how this is going to play out. When this is going to be discussed, but I'm looking at what Dr. Margaret Chan, if you remember, the World Health Organization director, who mentioned that really efforts to address non-communicable diseases, they go against the powerful interest of, the economic interest of very powerful business operators. Do you think this is a war that, just to frame it, that we are going to win and be able to convince even the sugar industry that yes, there's a need for them to scale down all this and look for ways in which to address sugar and improve people's health? How are we going to argue that case out?
I think it's a conversation that needs to be started.
It's already started. We are having
and it needs to be amplified. And because we are going against very powerful industry, I think one of, if not the most powerful industry in the food industry is the sugar industry. And going is really just making them accountable. And they know. The sugar industry knows that it's harmful, and when it's continuously over-processed, they know the effects of the body. The reason why they keep circulating it is because, one, it leads to addiction, but also the secondly is to keep their profit margins up. So they just need to be brought to account the same way we have now been bringing to account the tobacco industry players, the alcohol industry players, the trans fats industry players in some countries. I think we need to bring this battle now to the sugar front. And if we even have a slight win in really getting some regulation passed on how sugars are consumed, how they are advertised, how they are presented in various foods, I think it will be a very big win in terms of the improvement of health at a population scale, and as a result, improvement of productivity at a population scale.
But on that line of thought, maybe let me play the advocate here, or the devil's advocate. I'm asking myself, is problem really sugar consumption, or it is over consumption of sugar? So where is the battle line?
I think when we are talking about the environmental risk factors, or some of the risk factors that you can't really have a direct impact of, sugar is one of them, and this is why. When you buy tomato sauce, it has sugar. You wouldn't expect to find sugar in tomato sauce. It is hidden so well that you, as an individual who wants to practice healthy behavior and you are not actively consuming sugar, you'll still end up consuming it in ketchup. You'll still consume it in other products that you wouldn't expect. Canned beans has sugar in it. Whilst you are eating beans to get the proteins, you are getting the sugars. And that is why it needs to be controlled. Because however much the individual effort is placed to control the intake of sugars, still the environmental component has a much bigger play. If you go to Kibera right now, and in most of the informal settlements, it's much easier to find soda than to find clean water. Why is that? Because the sugar is hidden everywhere. So we need to find regulations, and especially at the policy level, that actually regulates where sugar can be placed, regulate how where it is placed is communicated to the consumer, and also regulate how consumers access the sugar. So, for example, if you have ketchup, I'll use that as a good example, or canned beans, there should be a label there that says this contains this amount of sugar. A big label. Just the way they've done it with tobacco. And on the other side...
So you're essentially saying nutritional labeling
Yes, nutritional labeling could be part of the intervention that comes across. But sugar industry especially needs to be regulated because individual effort alone cannot suffice individuals' ability to really maneuver the sugar consumption space.
Beautiful. I think this is a very deep conversation, and looking at sugar and how it's connected to oral health.
Yeah.
But again, also just noting that we might be looking at sugar in terms of the sugars that we get from maybe the ones that industrial sugar, but also look at in terms of how when we eat our fruits. And sometimes you don't realize that when we eat what do we do when you take your fruit and grate it or something? What do we call it?
You blend it.
You blend it. So that's the word I was looking for. You blend it, and now you're releasing free sugars. People need to be taught how that will also be contributing to their oral health issues. And I know it's really controversial.
Yeah, I'm about to pause you there.
I understand, and it's something that really invites a lot of controversy around it. But we need to be aware also about the free sugars, whether it's from blending or whether whatever you're doing, whether it's good to eat it raw or blend it or whatever. But what I think is coming from this discussion is that oral health is linked to or matched to sugar as a risk factor. But there are also other risk factors that we cannot overlook. Alcohol also leads to oral health. And I think that also make a case for oral health just to be included as one of NCDs.
Tobacco.
Now tobacco also leads to oral health challenges. So really, if you look at the other risk factors contributing to oral health challenges, why not just include oral health as part of the NCDs? And I think that makes me now, again, getting this conversation to want to really also support the 6x6 approach and push for its inclusion as one of the NCDs.
Yeah, I think overall that is going to be one interesting space to watch in health. And I think we will see by 2025 whether the sugar industry played their cards right to remove this from the conversation, or if the health team played their cards right to include it in the conversation. It's going to be an interesting interplay to really explore and monitor so that we see the development around that. But I think that is just a good quick snapshot on really the conversation around oral health and sugars and its inclusion and upcoming conversations now. And we will end it at that, and hopefully in another episode really go now into even greater detail talking about the topic. I think with that we will see you on the next one.
Okay.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storelink and at NCD Champions. See you on the next one.